thanks, Julia, for coming all the way from England to attend our forum on catalyzing social impact. How's it been for you so far?
Oh, thanks, Angela, and thanks for inviting me. It's been an absolute privilege to get to know the Swasti Health Catalyst team better, and more than that, to meet with all of your other partners. Everybody's coming with such fascinating perspectives, really interesting ways of looking at problems in new ways. So it's really been a great learning experience.
Oh, that's good to hear. What problem are you looking to solve in what PCI does?
So what Primary Care International is doing with partners around the world is looking to strengthen primary healthcare models that have the potential to reach vulnerable communities where they are, rather trying to remove some of those barriers to access and at the same time addressing quality, because we feel that that should be an integral part to any good primary healthcare model.
Yeah, so our vision and mission is so aligned. Are you taking back, or what is the one thing that you would take back from this experience at the forum?
I think one of the things that I've noticed as a common challenge across a lot of the countries we're working is this notion of needing to work with healthcare teams, because a lot of times a doctor isn't available, and working on models which are driven by nurses, which involve community health care workers, so that there's a whole continuum of referral pathways and continuum of care. That's something which I've seen really strongly in the Invest for Wellness model, which also has a lot of applicability in other places. So it's interesting to compare how that's working with how it's going in other places that we work in Africa and the Middle East as well. And the other thing that I've noticed these 2 days especially is around the potential for technology. I first came to Bangalore 16 years ago, and I feel coming back now, today, it feels that the reality of technology being an enabler for poor people to access healthcare is a lot closer to becoming a reality. It's going to have its challenges still, but that's something that I can really see the barriers are coming down around technology. So that's quite exciting for me.
That's great. I hope you are able to network and meet other people in the space. Like you, it's not just Indian, but I think there are a lot of people representing different countries that are trying to solve societal problems. And did you see any cross connections with health and other domains in your conversations that you've had?
Yeah, for sure. And at PCI, we've done a lot of thinking in the past about multi-sectoral approaches to healthcare, and it's really clear that primary healthcare isn't something that can operate in a silo, because it interconnects with everything else in the ecosystem, right? So anytime you would talk about a primary healthcare model, you need to think about the social and behavioural change, which obviously has had a whole solution circle around it at this forum. Again, livelihoods, there's a real close connection because of the interrelation between poverty and access to healthcare, and so a lot of the stuff that we've been thinking about around supply and demand for healthcare is quite interesting in what I've heard these past couple of days. So, for example, you may create a lovely, good quality service, but if the demand from the community isn't there, then something must be a bit wrong in that model. And how are you going to work on creating the demand? And it might be that you need to come at it from a sideways angle, and maybe it's through a livelihoods lens that you might start, for example. So many interconnections to carry on exploring. So
I hope you got some fuel to take back with you as you grow Primary Care International and scale it around?
Yeah, definitely. There was some interesting conversation actually about whether you want to scale your organisation or whether you want to scale your impact. So that was really nice, because I guess the way PCI works is that we aren't about delivering services directly ourselves, but helping partners to really create models which can be high quality and scalable. Yeah, exactly. And so that whole concept of scaling your impact without needing to worry about whether you've scaled your actual organisation, that's quite
interesting.
Yeah, also quite empowering in a way to think you don't have to be hung up on your organisation, but let's think, collectively,
about
how will we?
I think that's very powerful. At Swasti, we've had those struggles. Do we want to be the blue whale, or do we want to be a shark? So it's really that comparison. Do you want to scale the organization, or do you want to scale the impact? And I think I popped into that room for a bit, and there were some very interesting conversations going on.
Yeah, definitely.
Again, the day is wrapping up. I'm thankful that I was able to steal your way, and really grateful that you were able to make it from far away.
Oh, well, thanks for the invitation, Angela, and we're looking forward to carrying on the partnership.
Absolutely. Thank you.